so we can hear everybody clearly. And again, I want to say good morning to each and every one of you. You look so great this morning. We're pleased that you're here with us. And we're going to go ahead and start our meeting with our opening prayer from Reverend Love.
Yes. Good morning, everyone. Let us pray. Lord, thank you for this wonderful day that you have made. We thank you for this productive meeting, and we just ask for your insight and your wisdom to be upon each one of us, Lord, as we do the business of the city of Tuskegee as well as the county. We love you, Lord, and we just bless you for each person. God, we thank you that you have equipped us to do this ministry, God, for your people, Lord, and we thank you for this task force, Lord. As you speak and give us direction, Lord God, we know that the provisions have already been made, and we just walk into the authority, God, that you have already ordained. We bless you, God, for every person. Now, God, give us your wisdom and your insight, and we thank you in advance. In the name of the Father, the Son, and the Holy Spirit. Amen.
Amen. Thank you so much, Reverend Love, for that wonderful opening prayer. And so just before we get started, I wanted to share, as many of you know, last week, Attorney James shared with us that some individuals from the Center for Disease Control and Prevention would be in Macon County doing an assessment. And they asked if they could attend this task force meeting, and we did open that invitation. We have several of them on the line today. They are here to observe our meeting, and so we will conduct our meeting in the usual way that we do. And then if we have enough time at the end, we will allow them to perhaps ask any questions that they may have. This assessment is being done. Alabama was the first state to request this assessment. That's in related to COVID-19 and possible hesitations on vaccine. But they're also looking into other areas related to health disparities too. In the state of Alabama, only 2 counties are being assessed, and that is Sumter County, where they were last week. That includes Selma, Livingston, and York, that area over there. And of course, Macon County, which they will be here this week. Many of you your names have been shared with them individually, and they probably will contact you for a one-on-one interview, but they did want to see how we were conducting this task force. And so for their benefit, I'm just going to share a quick overview that this task force is made up of entities across the county, which includes but is not limited to education, law enforcement, the judicial system, community organizations, community leaders, faith-based organizations, and regular community citizens. So with that, I'm going to go ahead and continue with the meeting, and we're going to have remarks on behalf of Dr. Morris from Dr. Perry.
Well, good morning, colleagues, friends, and supporters. I extend greetings on behalf of Interim President Dr. Charlotte Morris and the Tuskegee University family. Thank you, Attorney James, for arranging for our CDC guests to be with us this morning. They were invited to Alabama by the Alabama Department of Public Health to conduct a rapid community assessment, which is fondly referred to as an RCA, which will be further explained by Attorney James in her healthcare subcommittee report. A warm welcome from Macon County to Dr. Beth Rubenstein, may also be called Rubenstein, Damian Dennison, and Leah Beavers. We also expect a guest from the Governor's Office of Minority Affairs, Attorney Nichelle Nix, who is the director and who also may be able to join us. So thank you for joining us at our Macon County Community Partners Task Force. And now we return to the facilitator, Ms. Bernice Frazier.
Thank you, Dr. Perry, for that warm welcome and introduction. We're going to move right into our group reports. And as you can see on the agenda, after our committee reports, we will have some key updates from key individuals in the community. So we will go right into our comprehensive healthcare response, and that's Attorney James and Sister Mrs. Joyce Carmen. Attorney James.
Miss Joyce, you're on mute. She will give the overview from our meeting, and then I'll give the brief update on RCA.
Okay.
Okay, thank you.
Wednesday is our regular meeting day, and our regular attendees were there, with the addition of one of our certified contact tracers, Vera Smith, and Dr. Dunn joined us also. Our agenda included discussion about wraparound services for the units that we were to get for isolation, and repurposing contact tracer roles and self-care. Discussion, there was wraparound services for isolation rail car units were discussed in detail. The Kroger and Chick-fil-A grants forwarded by the Distribution Resources Group was looked at and further discussed at the joint meeting of both groups. Both grants are currently being studied for possible use for these services. Our community contact tracing and repurposing their role in the community and county was discussed also. Because of HIPAA concerns by ADPH, our community contact tracers are unable to perform the traditional contact tracing that our certified contact tracers are trained for. We're discussing other ways to employ our services, and discussions about possible inclusion in the hotline being developed by the distribution group, and possible MOUs with clinics and private practices that request contact tracing services were had. We had also had a short discussion on mental health and being certified for mental health first aid, and a possible train the trainer course, tuition to possibly be funded by CDC. I didn't mean that CDC. COVID-19 funds for the mental health first aid course. An informative presentation on self-care was presented by Erica Muhammad and will be presented by Erica Muhammad and Dr. Danita Muhammad to the task force. Crystal, Attorney James, updated the group about the visit of the CDC, ADPH, and GOMA, a state minority affairs agency. We, after much discussion, I left out a lot, but after much discussion, we adjourned. And so Crystal, you and Erica and Dr. Danita can take that away.
Thank you, Ms. German. I just wanted to take a couple minutes at the start of our meeting. I know as the members from the CDC are engaging in our community, the question might come up as to what a rapid community assessment is and consists of. And so I wanted to provide that information not only to this meeting, but also for publication to our website, so that any other community members that are engaged will have a clear understanding and not in trepidation about the purpose of this assessment in our community. It is, as was mentioned by Ms. Frazier, we were identified by Alabama Department of Public Health, and through looking at the actual vulnerability data about our county, and that's how we were selected. The general purpose of an RCA is to identify communities at risk for low COVID-19 vaccine uptake and to inform future phases of the vaccine rollout, and also get an early understanding of what communities are thinking about COVID-19 vaccines for potential solutions to increase confidence in uptake. As a part of the assessment, as Ms. Frazier also mentioned, there key informers from the community will be identified by discussions with community leaders and trusted messengers, and then they will identify areas of intervention and prioritize potential intervention strategies to increase confidence after having conversation engagement with these community leaders and gathering further information from those key informant contacts. So the assessment consists of about 5 steps. Given the urgency of COVID-19 pandemic, it's suggested that a time frame is 3 weeks. And I think they're in the middle of that, and engaging the 5 steps for both counties in the state to give an overall assessment. So the steps are listed there, and in the interest of time, I won't read them to you, But I can tell you that all the information that is provided here in this presentation did come directly from CDC's website, and the link is on the very first page of this presentation. And if you would like to get that detailed, this presentation will be sent to Pastor Manuel to be uploaded to the Macon Cares website for all the community to have for their consumption. During that first week is usually in-house, where they do the planning and get buy-in from stakeholders, which has been completed. And then they move into implementation and analysis, which is in week 2. And using a specific decision tool, again, the links to the tools that are used are available on the CDC website if you'd like to see some samples of those. And then week 3, they report findings and an action plan back to the state, which again will be available for the public to consume once completed. So we always end with our messaging, just continue to stay safe and mitigate. And so I will turn it over to Ms. Muhammad at this point.
Okay, now you can hear me. I'm pulling up our PowerPoint. And this is a presentation that was put together by Dr. Darnita Hill Muhammad and myself, Erica Muhammad. Let's get this on presentation mode. And this is mainly about the immune system. This is the keys to self-health care, maintenance, and survival. And the first section is naturally strengthen and build the immune system. So these are tips that can help you to fight off and prevent not only COVID, corona infection, but also help control and treat pre-existing conditions like high blood pressure, diabetes, heart disease, cancers, and other infections. So the key for this is to help our community to strengthen our immune system so we're not susceptible to COVID or other types of infections. And I'm going to ask Dr. Muhammad to jump in whenever she can. So the first area here.
I am here. I'm here. I'm gonna, wherever I'm needed, I will assist.
Excellent.
You can go right ahead.
All right. So the first area here, we want to learn how to calm down, because dealing with COVID is very stressful. Dealing with a COVID diagnosis is even more stressful. So these are some just general principles. You want to practice your positive thinking, your deep breathing in of fresh air, and take a daily walk, which is the best exercise, or any other kind of exercise to keep your body physically fit. And prayer also is a staple, because what has been learned about prayer is prayer and meditation can induce something called the relaxation response. And that will cause your metabolism to decrease, your heart rate will slow down, your blood pressure goes down, your breath becomes calmer and more regular. So this can help you in times of distress to get back into that calm place, because that type of physiological stress, it works against your immune system. You want to prepare nutritious foods. So this is so key, because when we look at our pre-existing conditions, we can trace them back to eating the wrong foods. So you want to limit the amount of meat, sugar, cheese, ice cream, and fried foods that are eaten. And you want to increase the amount of anti-inflammatory, antioxidant-rich fruits, vegetables, and omega-3 foods. And here are just some examples. Fruits, your berries are very high in antioxidants. So elderberries, raspberries, blueberries, lemon, lime, apples, oranges, melons, etc. Vegetables, focus on your cruciferous vegetables like broccoli and cauliflower and Brussels sprouts. Also carrots, beets, onion, squash, and leafy types. Legumes, which are your dry beans, particularly your navy beans, black beans, red beans, lentils, and your grains, whole grains. Seeds that are good in your diet, sunflower, pumpkin seeds, almonds, and then of course we have garlic, turmeric, ginger, etc., green tea, and black coffee, and wild salmon. Another key to building your immune system is intermittent fasting. And this is where you take a break from eating. And to begin this, you can try fasting for at least 8 hours during the day. And you could try that once or twice weekly. And then you could build up to eating 1 meal per day until it becomes a habit, and you'll feel stronger, and it has a corresponding effect on your immune system. And if you must eat in between meals to take medication, eat only dry wheat toast, light broth or soup, a piece of fruit, smoothie, or other nutritious snack. This is important, and that's the elimination of any bad habits that you have, because all of these are going to reduce your immune function. So smoking, cigarettes, or marijuana, that's going to cause inflammation in your lungs. Frequent drinking of sodas and alcohol, they each have a problem for the body. Arguing and shouting, inactivity, sleep deprivation, self-hatred, and chronic stress. Chronic stress is a killer. You want to stock your pantry. You want to store enough food to last 3 to 6 months in case of a public health or safety emergency. You want to store dry goods and home canned foods that can last for years, like rice, dry beans, dry milk, pasta, etc. And you always want to have enough clean water in your home to drink that will last for several weeks to months. And if you must isolate or quarantine because of a COVID diagnosis, you will want to have food on hand so you don't have to worry about shopping. Homegrown vegetables. If you have space, and everybody has some kind of space, so either your backyard, or you can even use containers on your porch or even your windowsill. Begin digging beds for your own vegetable garden. Grow your own tomatoes, peppers, green beans, squash, okra, potatoes, etc. This is going to be the highest quality food because you know what is going into the soil and on your plants. Learn about organic gardening practices to eliminate the need for chemicals in your garden. Dry and save your seeds at the end of the season to replant next year. Now, here are some COVID-19 home remedies. So these are if you are diagnosed and you have a mild case and you're stuck at home and you want to feel better than you're currently feeling, here are some tips. First, you want to recognize what are the mild symptoms, which include runny nose, headache, nausea, cough, a dry cough or mucus cough, fever, sore throat, fatigue, and new loss of taste or smell. You want to know the difference between mild symptoms and severe symptoms. So you need to know when to seek medical care. It's good to have a trusted health practitioner to guide you anytime you're not feeling well. So you need to be able to get on the phone with your doctor. Of course, that is a problem in not only our county, but our state, because we don't have Medicaid expansion. So a lot of people don't have a trusted health care practitioner. So that's a problem that we have to resolve. So if you're not comfortable handling your symptoms, you want to be able to give them a call. If you have persistent symptoms for 3 to 5 days, or if you have worsening symptoms at any time, you want to seek emergency medical care if you experience bluish face or lips, difficult or rapid breathing. And just a note here, it's good to have a pulse oximeter and a digital blood pressure cuff at home to measure your blood oxygen levels, your blood pressure, and heart rate. If you have persistent pain, extreme weakness, or pressure in your chest, and if you have a new confusion or inability to arouse, it's time to call 911, particularly if you're short of breath or your symptoms are getting worse. You need to go to the emergency room or the hospital. These are medications here that your doctor may consider, and you, the patient, need to ask questions because COVID is a novel virus, and what the medical community learns about COVID is changing by the week. So you want to know the type of questions to ask your doctor. If you are not offered any treatment for your infection or illness, this is not acceptable medical care. So you need to know that up front, and you can review the medical oaths of office. Some non-prescription medications that you can purchase at your local drugstore that have shown effectiveness include aspirin, naproxen, ibuprofen, and Mucinex. And some prescription medications that are well studied, these are either oral or injection, breathing treatments with albuterol, steroids, Zithromax, doxycycline, ivermectin, hydroxychloroquine, Rocephin, or I can't really pronounce it, ceftriaxone, which is IV only for developing pneumonias, And biologic agents such as monoclonal antibodies, interferons, and there's some examples here, heberon, which is the human type alpha interferon used in Cuba, and Paximune, which is a bovine-based interferon. Now, the treatment of mild symptoms, this is self-care maintenance that you do at home. You're going to first isolate yourself from other family members. And this is true whether you have been diagnosed or whether you've been exposed. You want to stop any exposure to your family members or anybody outside your household. And this is how you begin your treatment. So we're going to list the vitamin regimen that will be coming up in this PowerPoint. Some nutritious soups, no heavy foods, dry toast, lemon lime water. You want to stay hydrated, and warm fluids, tea and broth, and tonic. So at the end of this PowerPoint, there'll be some recipes for making different types of broths and tonics. We won't take too much time in this meeting with the recipes, but they'll be available on the website for you to download. And you want to identify a medical clinic or provider in case you must go and get a medication or an injection. These are some mouthwashes and gargles that you can use. So morning and night, you want to gargle with a 1-to-1 diluted ratio of hydrogen peroxide to water. Make sure you do not swallow or drink the peroxide. You want to gargle twice daily, in the morning and in the afternoon. You may also substitute a solution of 1/4 cup water mixed with 1 teaspoon baking soda for a mouthwash and gargle. Then there's always the salt water gargle. And lastly, studies and scientists have suggested that gargling with Listerine and chlorhexidine may disrupt viruses and bacteria that enter through the nose and mouth. And remember, this is information only. You need to consult with your doctor before you try any of these techniques. Vitamins and minerals, always follow instructions as directed on bottles and consult your healthcare provider on the dosing that is right for you. The most important vitamins and minerals in fighting infection and disease prevention are recommended. These are generally safe to take at doses listed below and currently widely available at your local drugstores. Doses are daily when you're not feeling well or exposed to others with infection, or if in seasonal change or winter months. Otherwise, if healthy and well, consider taking twice weekly. And remember, this is not for use as medical advice. Check with your doctor before adding supplements to your diet. So we're going to focus here on vitamin D, vitamin C, and zinc. We can't do justice to these 3 vitamins in this short PowerPoint, but I do encourage you to do your own research on these 3, particularly vitamin D. Most of the severe cases of COVID are people who are vitamin D deficient. Sunlight is a great and free source of vitamin D. However, many of us need more and must take a supplement. You can consider taking between 1,000 to 5,000 international units a day. Vitamin C, which is found in oranges, lemons, limes, etc. Dosage 1,000 to 3,000 milligrams daily. Zinc, found in nutritious grains, almonds, avocado, etc. 5 to 50 milligrams per day. Take once daily as directed on the bottle. Getting zinc into your cells, zinc needs a little help getting into your cells. So these are 2 options you can try. One is tonic water, which you can purchase from your local grocery store. And this has quinine in it, which is something called a zinc ionophore, which is a substance that helps the zinc get into your cells. You can sip 4 to 8 ounces per day if you're not feeling well, or 2 ounces daily if you've been exposed to infections. Another alternative is quercetin, which is another zinc ionophore and also an antioxidant, 250 milligrams a day. And on the picture, you could see the quercetin content of different foods. You see elderberries is really top of the list, and red onions are also at the top there. Here are some herbs, biologics, and other nutrients. So here are some respiratory herbs: horehound, eucalyptus, osha root, mullein, and ginseng. Again, these are things that you want to study independent of this presentation because we just don't have enough time to get into all the properties of these. Echinacea, astragalus, melatonin, coenzyme Q10, and kombucha, which is a source of probiotics, and probiotics help build your immune system as well. Other immune system boosters, sunlight. So in addition to making vitamin D, sunlight has other properties that help to strengthen your immune system. And at the end of the PowerPoint is some references, and you can pull up an article on that. Hydrotherapy is another ancient form of building the immune system, and it deals primarily with alternations of hot and cold water. Again, there are links in the references. And antioxidant support. These are supplements. Of course, there are foods that are high in antioxidants, but I'm going to just call this one EGCG because I know I'm going to mess it up if I try to say it, and NAC. So these are two supplements that you could talk to your doctor about, but COVID is full of oxidative stress on your cells, so it is very beneficial to increase your antioxidants. Here's some additional home care strategies. Rest, breathing exercises. There are certain breathing exercises that actually help strengthen your immune system. There are other breathing exercises that reduce your stress. Head elevation to reduce coughing. Proper hydration, that's very key, because if your lungs are not properly hydrated, they have a much more difficult time expelling the things that they're trying to expel. You can use steam from the shower or humidifier. You can do chest clapping to clear mucus. You can just have somebody pound on your back, known as physiotherapy, but it really helps to loosen up mucus that can get caught in your chest. And then there's something called a Valsalva maneuver to help unclog your ears. You need to check with your doctor if you have any cardiovascular concerns. And there's a link in the back on how to do the Valsalva maneuver, but it's basically like blowing your nose, but you're going to keep your nostrils closed and apply a little pressure like you're blowing your nose. Okay, so this is the section on the home recipes. I'm not going to focus on them. I'm going to just kind of go to the back. These will be available for you to download. But these are herb teas to try. You want to really just be taking a lot of tea and broth. Here's an immune building antioxidant tea. The picture there could show you the effects of oxidative stress. So the same thing that you see going on with the apple is going on with our cells. So we want to stop that process. Elderberry tonic. I do want to point out that the fruit of the elderberry has some cyanide components, and you have to cook this properly before you consume it, and check with your doctor. This is an Ayurvedic cough broth. This is what we use in my home for every illness, and it works very excellently to calm a cough. This is fire cider. Some of you may be familiar with it, but it is so hot, it will really burn a lot of things out of your body. Lemon cayenne tea. This helps to thin mucus down. So a lot of times when you have a chronic cough, it's because the mucus is too thick. This is a vegetable soup, and this is just a way to get nutrients in your body, and it's just comforting. A couple other remedies you may know about already. Honey, you can take a spoonful of honey or put it in your tea, and that will help soothe your cough. Raw garlic is a natural antibiotic, and ginger has very strong anti-inflammatory properties. So that is the end of this presentation. I know it was a little long, but if you want to look at it more thoroughly, it will be available on the makingcares.org website. Here are some of the references. You'll be able to click on those as well. And thank you for your participation. And at this point, if there's any questions, Dr. Muhammad and I can answer any questions you may have.
Okay, so in lieu of time, Erica, and thank you so much for that presentation. All presentations you always provide are very informative and helpful. But in lieu of time, we're going to ask people to put questions into the chat box, and we'll come back and check them. And we can come back to answering questions once we finish the other presentations, if that's okay with everyone. So with that, we're going to move into our public policy report from Dr. Carter or Dr. Dunn.
Okay, I'm here. Good morning. let me just move along quickly since we are having a time crunch here. During our meeting, we did review, and again, remember, public policy deals with policy issues. We went back over some updates on documents that have been presented by us to the committee. The MOU regarding the between the municipalities, again, was delivered. We're just waiting for the final copy and follow up with communications. The Safer at Home order, again, was delivered. No, let's see, the curfew, I'm sorry. The curfew was delivered to the Macon County City Council, and the Macon County City Council did act on the 9th of this month and to reenact and reinstate the curfew, which took place on Monday, March the 15th. The mask and business licensure ordinance was approved and reviewed by the committee and sent to communications. We are merely just waiting for the final copy to be stored for our records. The working positional statement for the committee was also approved, and that should be going to the communications committee for placement on the Macon Cares website. There were ongoing conversations, and again, we're looking for a policy issue surrounding the ideas of the universal testing in the county, meaning expanding, trying to make sure that you get a more accurate reporting in terms of getting those people that you have a lot of shut-ins or persons that just don't have access to the current means for accessing screening or vaccination. The increase in the effects of the after effects of the disease, looking at what kind of policies and what kind of measures are being taken to review such. Issues of the ongoing disparities in Macon County that continue to compound this issue with COVID. And again, the problem that we have with COVID is a problem that we have with many other health conditions in the community, so that we can begin to look at it's an issue of disparity and not just in terms of health. Also, the question came up about people feeling as though they were penalized for not getting the vaccine. Looking and examining that concept. Again, we're looking at a policy concern. Long-term effects, again, that's back to the after effects of the COVID disease, but also the vaccine. Some people are interested in again, having more information regarding long-term effects of the vaccine, which we currently do not know. We're also, one extra component here that we're going to be definitely looking at is the new regulation regarding school children, the 3 feet distancing as opposed to the 6 feet, and following up on the actual research and the actual policy itself as it applies to Macon County school systems. That is all that we have for the Public Policy Committee report. If others from the committee have something that they would like to add, I welcome that at this time.
Madam Chair of the Public Policy Committee, we just need to make one correction. That is not the Macon County, it is the Tuskegee curfew, and that we should be clear about that.
Oh, okay, thank you.
Also, I'd like to say that all the documents have been approved and signed, and they were sent back to the Policy Council, and they and the other information has been disseminated to the Communications Committee to disperse those MOUs to the various entities.
Fantastic, thank you.
Okay, thank you so much, Dr. Carter and Dr. Dunn. And as we get ready to move into the next report, I do want to say happy birthday to Dr. Dunn. And we want to thank you for choosing to spend some of your special day with us. You could be anywhere, and the fact that you chose to be with the task force is fantastic. And so I know you're going to enjoy the rest of your day because it's made just for you. And we're going to have other birthdays that are coming up too. We have Miss Hopkins' birthday is tomorrow, and we have other individuals. So March is a very powerful month for birthdays, but I just wanted to acknowledge the fact that Dr. Dunn is spending part of her birthday with us today. So with that, we're going to move into the distribution and management resource committee report. Judge Cooper.
Good morning. We'll just get straight to the report here this morning in quick order. Do you have it, Ms. Frazier? If not, I can just share it.
You can go ahead and share it if you have it up.
Okay, we met over the past week. This is the efficient management and distribution of resources, a subcommittee. And we had a joint meeting, very good joint meeting with the healthcare response subcommittee on Thursday, the 18th. And to assist that committee with developing a budget based on the request for isolation units. As you see on the chart there, this kind of the very high level deals with the various categories that we talked about. And in those categories, of course, is the isolation unit itself, healthcare in terms of staffing, utilities, meals, PPE, all those items that are listed. So at this point, we had the first meeting on Thursday to assist with coming up with a budget for these items, and to once that budget is developed, is to pass it back to the appropriate persons, the task force for funding. Coupled with that is to look at the 2 grants, the Kroger grant as well as Chick-fil-A, and see if those grants will aid in funding this effort on the isolation unit. That's at a very, very high level. Not so much detail at this point. We're just trying to determine those numbers that we need, as well as how we can get this to go. Part of that meeting, after the meeting, post discussion with Pastor Manuel, he has basically agreed to look at the Tuskegee Ministerial Council being the lead 501c once a grant is identified to be submitted, so that the funds can funnel through the Tuskegee Ministerial Council. When we had the meeting on Thursday, we had Ms. Joyce German, Attorney James, Crystal James, and Ms. Erica Muhammad, as well as our regular, what I would call standing committee members on Thursday. This coming Monday, based on the work that has been done for what I call the automated call attendant, we would review that phone system that we're partnering with Community Action Agency on Monday, just to review it and see what it sounds like, and kind of check the language. That will happen on Monday. Ms. Walker can talk about when that's going to occur, and we'll get word out for those who want to make the phone call to that number and listen to it and offer suggestions. Keep in mind that this project on the automated phone attendant was developed by because of Ms. Walker's relationship with IT Front Desk as an in-kind gift to the Community Action Agency for the task force. So although sometimes we have to be careful when we say it was free, it's not really free. IT Front Desk absorbed the cost for developing this. So there's some cost. We're just not realizing those direct costs. They absorb those costs. So at some point we need to make sure we acknowledge that, as well as acknowledge other persons and agencies who have provided in kind to us. I'm going to scroll right down here. just get to next week. On Tuesday, we're scheduled to tentatively scheduled to go over to SCL and inventory the gloves that we have and move those over to the temporary distribution center. And we'll be working on this budget for the isolation units. And we continue to look at funding opportunities and distribution of PPE. Thank you.
Okay, thank you, Judge Cooper, for that impactful report. And I also know that they have been distributing the PPEs and other items that we have received, so they're not being stagnant. They are coming in and being distributed as soon as possible. If you have any questions for Judge Cooper or the distribution committee, please place them in the chat box and we will come back to them to get answered. We're going to go to our last committee report, which is centralized and multi-level communication systems. And following that, we will hear from our officials, starting with Mayor Haygood, and then Sheriff Brunson, and then that I see right now, and then Mr. Lee. I'm trying to see who else is on. And we may ask Commissioner Robinson. I do not see Chairman Maxwell, but then Commissioner Robinson to report on behalf of the county. And so we're going to have our report today from Leonie Chief Frazier. Chief Frazier.
Thank you, ma'am. And welcome to the CDC representatives who are with us and other visitors. And I'd also like to give thanks to the Utility Board of Tuskegee for always supporting our efforts. If you have questions about this task force, go to the website, Macon Cares. If you have concerns, go to the website. If you have doubts about what's happening in this community, go to the website. If you're not aware of the fact that the pandemic has unified this community in a way that it has not ever been unified since I have been here, and that's 20 years. You have those doubts or concerns, go to the website. The website is a good vehicle for us to understand where we are and where we're headed. And the feed-in that everybody provides to it is enabling us to attract attention, not only among ourselves, but among the community people. And then not only there, but attention around this nation. And I think that's important because Tuskegee has always been an international source of information and growth and development. So if you're concerned about it, go to the website. We are now in the process of collecting many stories, 4 to 5 minutes, of people who have been struck by the COVID-19. And the reason that we want to do that and put those stories on the website is because when people watch those short stories about the impact that COVID-19 had on them, and when you can watch strong, bold, courageous men and women admitting that COVID-19 is a very devastating disease, well, then it can be better ingrained in the psyches of people, and they can get a better appreciation for what it is that they are trying to understand about the pandemic. The only other thing I want to throw in here, since we are short on time, is that scams are rampant now. And the scammers are apparently feeling that since your attention is tied up in an unknown, that have you not only fearful, but doubtful that they can come in and take advantage of you now. And they're coming at us 100% strong. So be sure that you watch your bank accounts, watch your credit cards, avoid these telephone hooks, and watch your messenger hooks that are trying to draw you in. So communications is on the website. Anytime you need any information or reference, then go to Macon Care's website. And I'd like to compliment Ms. Erica Muhammad on that excellent report that she gave. Go ahead.
Thank you, Chief Frazier. And we did show the website. The link to the website is in the chat box as well. And you can go and explore the different aspects of that. And so now we're going to move into some key updates and hear from our officials is Mayor Haygood. And then following Mayor Haygood, we will go to Sheriff Brunson. We will go to Mr. Lee and then to Commissioner Robinson in that order.
Good morning, Ms. Frazier and committee. Would like to compliment, as Chief has said, Erica Muhammad and Danita Muhammad for the report that was given, excellent information. I think the key thing that's happening here is that we're putting out good information. You're putting out good information so people understand and make the choices that they need to make. And I think we're seeing more people make better choices based on the information that you're putting out. As Chief Frazier said, we have been getting a number of people coming to the community, and I want to again welcome those from the CDC who I had a chance to interact with yesterday. We have people all over the nation that are looking at Tuskegee and seeing how we're responding to this pandemic based on what happened with the government.
Mayor Haygood, you are muted.
Yeah, the most important, was I muted the whole time? Oh, okay. Most important thing is that we put out good information so people can then make good decisions. We've had a good panel that came here and involved a number of people from the committee. They put out some information. Others have been followed up with WSFA and will continue to follow up sharing information. So as we put out good information, I think the key thing that I see that I shared with the representative from the CDC is that people are now, who had some hesitancy, are beginning to decide to take the vaccine. And for many of us, we feel that's a good thing. There are some who still have questions. I think the main questions that we see, as Dr. Carter say, are the long-term impacts. And I think that's the strongest thing that can be done. If we get more information about the potential long-term, any long-term impacts from the vaccine, then that will continue to erode the hesitancy that many people have. But I'm very pleased of what we're doing, as Chief said, as entities working together. There are resources available, not only for those, for information related to the vaccine and vaccine sites. It's information related available in terms, there are resources available in terms of rental assistance, utilities assistance. We're working with Macon County Commission. So those, people who are suffering economically as a result of the pandemic, please contact the Macon County Commission. Working through, I think we're working with the Community Action Agency, Ms. Walker, and there will be money there for rental assistance, utility assistance, not only for individuals, but businesses as well. So overall, I think we are moving ahead. We're meeting this challenge. We're working with the people who come here and try to provide the best information we can. But I think the key is we have to continue to share good information. A lot of people don't act or fail to act or share bad information. That puts us all back. That puts any potential progress back. So whatever our position is, let's do it based on good information. I think some tremendous information was presented today about preparing our immune systems. And as we continue to do things like that, I think we'll make tremendous strides. So the city did pass the resolutions that were submitted by the committee related to the curfew. We will be looking at the mask ordinances for businesses. Although the governor is taking off her mask ordinance as of April 9th, the city has entertained continuing our mask ordinance. So we will need the assistance of the committee to support that, because a number of people are against it. Unfortunately, some of our young people still don't like some of the things related to this, and we understand that. They may not understand the real ramifications of it. But if we're going to continue mask ordinance, we need the support of this committee, and we need to share it with others. We will have that choice as we determine, talking with the attorney. I think Councilwoman Jackson, we asked, and the cities and counties can extend that mask ordinance. So that's where we are right now. I won't take up any more time. Be glad to answer any questions. You can call me directly. You don't have to ask them today. Thank you.
Thank you, Mayor Haygood. And so we're going to move right on into Sheriff Brunson.
Hey, good morning, everybody. I'm definitely glad to be here today after my bout with COVID. You know, I can tell everybody that COVID is real, and it really, really took me through the loop. And I really have a story to tell. But getting on with the report, we're still having some trouble with people gathering, you know, these large gatherings, people wanting to party and things like that. Sometimes in the city, sometimes in the county. We've been out a number of times in the last couple of weeks trying to prevent these gatherings, going to homes, you know, telling people that, you know, we're not going to have these gatherings. So that has been a problem, especially in the last 2 weeks. You know, people trying to have a spring break, people trying to have birthday parties and things like that, which are not allowed. So we have been dealing with that. This past week, we had our first case with COVID down at the jail. One of the trustees tested positive for COVID, so he was immediately put in our COVID center, the quarantine center, and that's where he is. We've been trying to make sure that nobody else tests positive. We tried to get everybody in the jail tested. If anybody can help with that, we talked to Dr. Maxwell's crew down there, and she suggested that we bring the inmates down to the center, to her place, but that's really not a good idea, maybe not even a possibility was, you know, so we're trying to get somebody that would come down and test all the inmates to make sure we don't have COVID inside the jail. One great thing is the guy that did test positive, he was a trustee and in a confined area anyway, away from everybody except 2 inmates, which we tested them and they were negative. But we know we especially need to get everybody tested in the jail. So if anybody can help with that or give me some suggestions, you know, I would greatly appreciate that. But everything else, we're still going through our process. You can't come into jail. If you come for business, you test your temperature. You have to have on masks and things like that. And we come into jail one at a time, even if you come down there for business. So we're still trying to maintain the safety there. And I think everybody here on this task force has been doing a great job, and I really appreciate that. It makes my job a whole lot easier.
And could I add to the sheriff's report, please? Sheriff, I'm finalizing that report for you on the first responders' capability of getting tested. We had 20 people tested out of the group that had the opportunity. Some chose not to be, and that certainly was their privilege. We had very few bad reactions after the first test, and I am now contacting people to see what their reactions were during the second shot. And I'm talking about vaccine rather than testing. Okay, so I just wanted to add that to let everybody know that first responders had the options. 20 of them accepted it, and we had very few negative reactions. Go ahead.
Right, and I can report to you that when the testing came back around, the vaccine came back around, we had a few more guys that opted to take the vaccine. So we need to put them in that too. So, and most of them have had their second shot now. So we can add that to the report before you finalize it.
Okay, sir, will do.
All right.
Okay, thank you, Sheriff Brunson and Chief Frazier. We're going to move now to Mr. Lee.
Very much, Chairperson Frazier. It's a pleasure for me to be here, and I would like to again just welcome our from the Alabama Department of Public Health and the Center for Disease Control. We met with them, and we thank Chairperson Frazier, Judge Biggers, Chairman Maxwell, and I had an opportunity to meet with them on last Wednesday. I just would like to just indicate some of the key factors that we will be stressing to them. And I think you all are aware of the fact, I think Erica mentioned them this morning about the fact that Alabama has not extended its Medicaid problem in the state, and that has exacerbated the problem of rural healthcare in a lot of our underserved areas, even prior to COVID-19. So we want to, again, overemphasize our concern as rural Alabamians, excuse me, regarding that concern with the lack of the expansion of Medicaid. Also, I would like to just report to the committee and the group this morning that we did make a request, Macon County did make a request to the Alabama Department of Public Health for its mass vaccination rollout. That rollout will encompass at least one, possibly two locations in the county that will be able to vaccinate our citizens on a first come, first served basis. The designated date, excuse me, is going to be April 1. There are two sites that have been discussed. One site we know that has been approved. It's the National Guard Armory on Chappie James Drive. We're not certain as to what time the event will start, but we will make everyone aware of that. Excuse me again. Currently in our county right now, we're at 1,512 cases and 46 fatalities. That number still is increasing. We are at a rate between 5 and 7 cases a day. And I just want to thank this group and all of our citizens for working along with us in our efforts to mitigate COVID-19 in our county. We will continue our daily briefing each morning at 7:15 on radio station WUBZ and on Sunday mornings at 7:30. The Macon County Commission continues to work on mitigation efforts, and I'm sure Commissioner Robinson will talk about the grant that we are pursuing through the South Central Alabama Development Corporation. At this time, I'll entertain any questions. And again, I want to thank everyone and thank our partners from for joining us here in Macon County.
Yes, Ms. Frazier, I do have a question for Mr. Lee, coming from the healthcare group. We want to know if testing can be done at these vaccination centers. Can testing be done concurrently with that? Because we do have a real problem in availability of testing. So we were trying to find out whether or not testing can be done alongside this vaccination setup. I mean, if you ask that question for us, you might not know, but.
Well, I can't ask if testing can be accepted. I don't have the answer at this time, but I can request testing. We have testing at the Macon County Health Department between the hour of 1 and 3. And that testing population has basically been pretty minimum. I will ask that we consider that, but I would like to encourage all of our citizens to take advantage of the testing at the health department each Thursdays from 1 until 3. We're averaging about 5 to 7 residents who are taking advantage of testing during that time. The testing is available weekly at the health department between the hours of 1 and 3.
I have a question to Mr. Lee. Is it possible for the Alabama, and maybe you cannot answer this, and maybe you can put it on the agenda, to change the hours from 1 to 3 to maybe like 3 to 6 or something like that? Because many of our people are working, and that 1 to 3 hour time frame is just not only convenient, but they're not able to get the services within that time frame.
I will ask that question and report back to this group.
Thank you, Mr.
Thank
Lee.
you.
Thank you, Mr. Lee. And we're going to real quickly, Commissioner Robinson, because I want you to be last. Attorney James had her hand up and she wanted to add something. So Attorney James, real quickly.
Yes, thank you, Madam Facilitator. In response to Chef Bronson's request for testing, the Tuskegee Health Disparities Diagnostic Center will process the testing of the if they can identify a clinical person to collect the samples. And through our stockpiling, I know that there were some test kits that are available and there may be sufficient number that's on stockpile. And so we just need to have a healthcare provider to be there to collect those samples and get them to our laboratory. And we can have those ran for you and processed.
Well, I really appreciate that. We only have about 38 to 40 people in jail right now. So if we had about 40 kits, we should be okay.
Okay, so we're gonna ask Attorney James. I will contact Dr. Muhammad, Dr. Maxwell Stanford, and see if she can assist with that. We also had some Tuskegee nurses that were administering the vaccine, Tuskegee nursing students that were administering the vaccine for her. We may be able to work out a process that way. And so Sheriff Brunson, we will get those entities together with you and work out that process to provide you with your assistance that you need.
We also have some test kits available, and we can add that to the pot as well in terms of our discussion.
Okay, I appreciate that. Thank you very much.
And Dr. Mohammed has volunteered to be the physician, so there shouldn't be a problem with this process.
If Dr. Muhammad is going to do that, then we definitely can get that done right away. We have the test kits already.
Thank you. Thank you.
Okay, so we'll just work out the logistics with you, Sheriff Brunson, to come out there and provide that service.
All right.
Oh, okay. So we're going to move on to Commissioner Robinson on behalf of the county commissioners.
Yes, good morning to, to everyone, and special welcome to our special guest this morning. Macon County Commission and of course Macon County government overall continues to do whatever it can to help mitigate these COVID-19 episodes and issues. Happy to report that the $750,000 that was allotted to Macon County for the COVID-19 mitigation efforts, we've been reimbursed for a little over $600,000 so far for funds that were expended during this past few months or last year. You heard mention of a new grant opportunity through ADECA, Alabama Department of Economic Community Affairs. We're working with South Central Alabama Development Commission in submission of a $300,000 grant to further help mitigate some of the COVID-19 issues. One of the prerequisites for that $300,000 grant, of course, is to get and have approval or support from all the municipalities in Macon County. And each of those entities, including the school system, healthcare authority, and all these municipalities have submitted recommendations. And I think we're all in agreement and for an application that will go forward by April 1st. Also, you heard Mr. Lee, continuous mitigation efforts. Thanks him for his continuous fine job of helping coordinate these efforts and identifying resources through FEMA and CARES Act and other sources for finding resources to help mitigate these efforts. Also, I wanted to report we're staying diligent focus on the funds. This recent congressional legislation, of course, that have come down to 1.9 trillion rather. Alabama is slated to receive several $100 million. I don't have the exact figure, but it's nearly $1 billion as a part of that. But Macon County is slated to receive $3.4 million of those funds. There will be some efforts by our ACCA, Alabama County Commission Association, and its attorneys to make certain that we adhere to the federal requirements and identify any restrictions to that $3.4 million, which should be available to the county somewhere in the next couple of months, say May of this year, as I understand it, half of it, and then maybe another half by June of next year. So it's slated to be distributed over a year's period. And finally, let me just mention there is a COVID-19 memorial that's scheduled for next Friday, the 26th at 6 p.m. At the courthouse to help just to put our arms around those who have been impacted by the COVID-19 and certainly those who have lost loved ones and the families of those individuals. So I'll stop there. So if there's any questions, I'll be happy to entertain them.
Okay.
I don't have a question, but I would like to make a comment, Commissioner. I hope that we will understand the wealth of communications and power that we have in this group that's in this task force. And I hope we will also understand the system and how it operates. And if it's $3.4 million designated for Macon County, I would like for us to thoroughly analyze that and determine whether it should be 3.4 or whether it should have been 7.4. And once we come to grips with the reality of exactly what they have, exactly what we've been offered, we determine for ourselves if we are satisfied with that, or if it's possible to get more to serve this county better. And then we move to squeeze the best juice out of that lemon that we can find. Thank you, sir.
Okay, we do have a couple of questions. We have a couple of hands up, but there is a question in the chat box from Erica Muhammad. It says, is the task force budget, and this is for you, Commissioner Robinson, is the task force budget included in the county COVID funds for April 1st?
There is a portion of those funds that have been included from the that has to do with the healthcare authority and its lab. I think the lab efforts or testing efforts, that's in there. The other items that are in that application have more to do with rental assistance, utility assistance, local businesses, school system, and you know, in other words, all of those recommendations came from the municipalities and felt that those items that I just mentioned would be of best benefit to the citizens in the area. But there is a portion there dedicated to the testing, I think, in the healthcare authority.
Okay, I want to thank you. Now, we are a little bit beyond our time, but I appreciate everybody staying. We do have a question. We have two hands up. One is Mr. Lee, and then one is Scott Muhammad. And so, Scott, I saw your hand first. If you want to ask your question quickly, and then Mr. Lee, we will go to you.
I'll go as quick as I can. Thank you.
Okay, thank you.
I have two questions for our CDC guests whom I cannot see. Can they come on so that we can all be able to see them?
They have just been on observing. They had not been showing themselves. I said they were on as observers. They were not showing themselves at the time. And I do want to go to them after we finish the questions that's pertaining to our meeting. So if your questions are just for them, if you could hold those and let Mr. Lee speak so that we can facilitate our meeting, is that okay? Okay, so Mr. Lee.
Madam Chairperson, I forgot to bring out one very important new factor from FEMA. FEMA has announced a couple of days ago that it will provide funding for COVID-19 victims for burial and also for funeral expenses. And we have that information on our Facebook page. We will pass it on. But that was good news for those families who have borne the cost of burying loved ones.
Thank you so much, Mr. Lee. And I also posted, Mr. Lee, I posted in the chat box your information about the mass vaccine rollout. So individuals, please remember to save your chat box, and that information is located in there. So Scott, just before we come to you, I want to allow the CDC representatives, whichever one of them would like to speak, to quickly introduce themselves, and then we will entertain your questions.
Hi, good morning. Can you hear us?
Yes, we can hear you and see you.
Okay, great. Thank you for the opportunity. We're so happy to be in Macon County, particularly Tuskegee, Alabama. We're already in the field, as you can see. We visited a farmer's market this morning and talked to a couple of people. So we're happy to get started. But I did want to provide our contact information for those who may want to participate or refer people to the RCA. Thank you to Attorney James for giving an overview of what the process is, but we would definitely like your support and help with contacting individuals. I see that Attorney James put that contact info in the chat, but I'll say it out loud. My number is 404-784-2612, and my email is dvd, that's Delta Victor Delta, number 5 at cdc.gov. And quickly, I'll do an introduction of the team. There's 4 of us in town for this week. Again, my name is Damian Denson.
Hi, I'm Elizabeth Wilhelm. Hi, I'm Leah Beavers. Hi, I'm Beth Rubenstein.
So again, we're happy to be here and answer any questions if people have those.
Okay, thank you very much, Damian. Mr. Muhammad, you can go with your questions now for the CDC individuals.
Yes, ma'am. As I said, I will go as quickly as I can, but this is a meeting. It's a long meeting, and I sat through it. So I do want to be able to properly ask my questions without being rushed, because I don't want to lose this very important opportunity, particularly on the heels of an announcement that there's going to be a memorial and people are being encouraged to hug one another. This represents, to me, a misunderstanding some of the bad information that Mayor Haygood spoke to, that people think that once you get the vaccine, that you're no longer able to contract or transmit the virus. So if I get the vaccine and I go and hug somebody, well, the vaccine may mitigate the more severe circumstances for me, but if I come home and my immune compromised grandmother who has an autoimmune condition that did not allow her to take the vaccination, I could infect her. And because there are no screenings before the vaccinations, we do not know who may also have an autoimmune condition that makes them vulnerable to adverse effects from the vaccine. So what we need is a sterilizing immunity to end the pandemic, not a mitigating of the severity of the disease. That's my preamble, if you will. We need a 21st century precision medicine, not a rumor about a one-size-fits-all panacea. But I want to say this, and I have to read this. There's a book for my CDC friends called Medical Apartheid, and on page 164, under the heading of Notoriously Syphilis-Soaked Race, there's a doctor, O.C. Wenger, who was the Public Health Service Senior Officer for its syphilis programs, plural, in a letter to Dr. Raymond Vondeler, who said, "There's one danger in the latter plan, and that is if the colored population becomes aware that accepting free hospital care means a post-mortem, every darky will leave Macon County. The only way we are going to get post-mortems is to have the demise take place in Dibble's office, hospital, and then these colored folk are told that Dr. Dibble is now a government doctor and they will have more confidence." My first question: some of us in this community will never consent to a vaccine from the pharmaceutical companies due to their sordid history of abuse leading to death and sickness in Black and brown people all around the world. Given the CDC's well-known primary role in the syphilis study conducted in Macon County under the name United States Public Health Service, and given the traditional abuse and disenfranchisement of poor Black people, are you ready and willing to work with sensible, realistic alternatives to your vaccine push? Or is it vax or nothing? i.e., can we deal with investing in HBCU proper vaccine development, and will the CDC assist with lifting the embargoes off of Cuba so that we can get medication from our own people that's been shown to work in Black people around the planet? That's question number one. For part two, I want to say this, because I'm not from the upper crust of Tuskegee. And a lot of our upper crust are very comfortable with the vaccine, but a lot of our under crust is not. And I have a great concern because we are not properly represented. I saw the WFSA piece. None of my views and none of the views of my constituencies and colleagues were represented by that. We did not feel that. We did not like that. 2 years ago, we had a conference and we showed a movie called Vaxxed, which demonstrated it. These people got Black mothers from around the country and white ones whose children were injured by vaccines. I showed that to Crystal James. We had a forum because we wanted our community to benefit from a deliberative dialogue about the efficacies of the MMR vaccine. That is fair for our community. Our community deserves this. I went to Crystal. I went to the public health department of Tuskegee. I went to Reuben Warren. Everybody I went to, couldn't nobody get the CDC to come. I sat in the office of one administrator while she called person after person, some of whom she personally knew from the CDC, and they never thought enough of our ask to even respond and say, Negro, no, we ain't coming to your forum to talk to you about vaccines. Take it or leave it. No, nobody did that. But now there's an agenda on the floor with a big vaccine push, and you show up. I want to know if you all would consent to a deliberative dialogue about the efficacy of this vaccine and the efficacy of the MMR vaccine with a group of scholars and scientists that we put together. Will you, in fact, stand on your position in the public with other scholars? And just for the record, I want to say this to my colleagues on this call, on this task force, because people keep letting the term anti-vaxxer go. When I go to these meetings around these counties and stuff, right now, they don't have my name on there. They'll say Scott, but then he, him. You can't even call me male without my consent. You can't call my wife female without her agreement, but you can call me an anti-vaxxer and keep it pushing, and that's foul. I am a vaccine safety advocate. To call me an anti-vaxxer is a complete distortion of my actual position, and that should not go on. And I know the CDC is guilty of pushing that language through the country, and it is absolutely creating a condition and climate where people like me who have concerns, you cut my voice off. And some people pretend that they love the Constitution, but they cut my First Amendment right to speak on my own behalf off. So I would like the CDC to speak to those two pieces. One, will you be willing to actually work with us on something other than the vaccine? And two, will you come to a deliberative dialogue to defend your vaccine position?
Yeah, we're gonna go straight to them, and then, but I do want to acknowledge Chief Jenkins is on the line, and so after we do that, we will hear from you, Chief Jenkins, from the city of Tuskegee. Any member of the CDC?
Sure. Yeah, we appreciate that concern. Again, this is a listening session. This isn't opportunity for us to proselytize on the vaccine. We're here to learn from the community and hear about those concerns. So all of the issues that you brought up are the things that we want to hear, and we want to collect that and take that back to the health department and the Centers for Disease Control. So again, our contact information is in the chat. Give us a call. We'll set up a time to have a conversation, and we can talk more about your specific questions that you listed here.
Also, Damian, I did supply Mr. Scott Muhammad's name for you to contact to interview. I talked to you about him Thursday. That was the individual I was talking about that I thought that you should definitely speak with. So I'm sure, Mr. Muhammad, they're going to contact you to set up a one-on-one. Okay, Chief Jenkins.
Good morning, everybody. I just wanted to speak on behalf of the police department. We do have some people that were interested in the vaccine. We did have some people that did get the vaccine, both doses and both shots. I do have some people that did have some concerns on it. We supplied them with as much information as possible and sent them to other outside resources so they can do their own research on that issue. I haven't taken the vaccine yet. On one of them, there's some ingredients in it that I'm allergic to. So I do have to make sure that I do my due diligence on my part before I actually go take it myself. But as far as that, that's all I have for this time.
Okay, thank you, Chief Jenkins. And so next week, our facilitator would be Dr. Lucinia Dunn. And so we're going to ask her if she has anything that she would like to share with the task force or request that she's going to have for next week's meeting. Dr. Dunn?
I'd just like to compliment everybody that gave a report today. I think that CDC got a pretty good idea about the fact that we in Macon County have come together despite the fact that we do not have a hospital, despite the fact that we are suffering from a high level of health disparities, and that we are pushing forward to correct all of that, and we need all the help that we can get to do so. Next week, we will do the same thing that we have done this week, so that CDC needs to understand that this is not a special meeting. This is what we do every Saturday at 10 o'clock. We share information. We listen to various points of view, and we continue to make plans that are very substantive around what we can do with the resources that we have. As Booker T. Washington said, cast down your bucket where you are, and that's what we do. So we look forward to everybody being on our line at 10 o'clock on next Saturday. And thank you so much for your birthday wishes. I'm not going to tell you all how old I am.
Thank you, Dr. Dunn. And I also like to let you know, Dr. Dunn, that Superintendent Brooks stated that she could possibly start attending the meetings again next week. They are finishing up their testing for today. She really wanted to be on today, but she had that prior engagement. So we look forward that our superintendent will join us starting next week. Okay, so very quickly, and I know that we're about 30 minutes over time, but if there's anybody else that would like to add any information, we have former Mayor, excuse me, we have our former mayor on, Mayor Omar Neal, if he'd like to share anything from the communications aspect. And I'm trying to look through and see if there's anyone else. But Mayor Neal, do you have anything you would like to share?
No, nothing but perpetual appreciation for this task force and all of the things that are being done, both seen and unseen. We are appreciative, and thanks for all you do.
Okay, and we also have Ms. Walker from the Community Action Agency, who is going to be helping to administer those funds, where we will be able to assist people with rent and utilities as a recommendation from this task force. So Ms. Walker, do you have anything you'd like to say? Is Ms. Walker?
I'm sorry. Good morning, everyone. I just want to say that I'm very grateful and thankful to be a part of this task force and to be able to provide any type of services and support to the citizens of Macon County. So I just really appreciate being able to be here and be able to offer my services and my experience to this task force. So I really appreciate it.
Okay, thank you, everybody. Please quickly remember to save your chat box. And I'm going to encourage you all to have a great day. We're going to encourage Dr. Dunn to celebrate a little bit with her birthday. And I already know how old you are, so that's all right.
Well, the day is the first day of spring. So everybody relax and have a good time. And just because it's not your birthday, it's all right. Just have a good time. All right.
I gotta say, Dr. Dunn, you are Tuskegee beautiful. You know that, right?
Thank you. I appreciate that. Take care, you all.
Okay. Thank you. Okay. Goodbye, everyone. Enjoy the rest of the day.
Goodbye. Goodbye.
Bye-bye.
Close that up and move it back to the